प्रणाम, राधे राधे. ओम गुरुभ्यो नमः, ओम महागणपतये नमः, ओम सरस्वत्यै नमः, ओम धन्वन्तरये नमः. So today we are going to discuss supporting healthy blood sugar. Nowadays everybody have a blood sugar issue because we eat lot of different kind of food without noticing how much sugar is it is inside. Sometimes you eat normal roti, but if you eat more roti also, because it have a wheat, and wheat can has a gluten, and it can also increase your sugar. So the thing is that today's important topic is really supporting healthy blood sugar. And to discuss this, we are going to invite the expert, the distinguished expert in the field of Ayurvedic and naturopathic medicine, Dr. Shailinder Sodhi. And he regularly comes on this channel as a guest. So Dr. Sodhi holds dual degree as a Doctor of Naturopathic Medicine and Bachelor of Ayurvedic Medicine and Surgery, also known as BAMS. He comes from a long lineage of Ayurvedic physician and has dedicated his life to integrating the profound wisdom of Ayurveda with modern scientific approaches to healing. See, remember, we have to keep evolving the innovation. So Dr. Sodhi brings innovation along with keeping the old tradition alive. He is the president of Ayurvedic Herb, a globally respected herb company, and has been a passionate advocate for promoting authentic Ayurvedic knowledge around the world, along with authentic Ayurvedic medicine. Nowadays, we see so many medicine, like so many brands, but sometimes we do not know how do they make it and what is the authenticity of that. So you need somebody who has a well-reputed name in making Ayurvedic medicine. So that's where Ayush Herb comes. With the decades of clinical practice, teaching, and research, he has touched countless lives by helping individuals reconnect with their innate ability to heal naturally. So, heal naturally is really important with the help of herbs. Please join me in warmly welcoming Dr. Shailinder Sodhi in today's very special discussion on Ayurveda and supporting blood sugar, healthy blood sugar, and managing it. So let's invite Dr. Shailinder Sodhi. Please welcome him.
Om
So Dr.
Dhanvantaraye
Sodhi,
Namah
Pranam.
Panditji. Pranam.
Om Dhanvantaraye Namaha. So we had a talk with you last time on heart health. So today we are going to talk about Ayurvedic medicine and diabetes. So Dr. Sodhi, thank you for joining us. To start, can you explain the core Ayurvedic principle relevant to blood sugar balance?
Panditji, the core principle for managing the diabetes as per Ayurveda is how we understand our constitution, how we understand what goes in our body, how we eat our foods, and also understanding our genetic weaknesses or vanshas diseases according to Ayurveda. If we understand all that aspect, we know how vulnerable we are in case of getting diabetes. As you understand, that diabetes, there are two types of diabetes: diabetes 1, diabetes 2, and then also the diabetes which is caused by the certain medications, but that usually combined with the diabetes type 2. These are the modern diagnostic codes. For diabetes 1 means the individuals who are not producing enough insulin in the body, and it can happen at any age, very early age, and even the later age. The diabetes 1 usually starts in early age, and these are the individual who needs insulin to support the sugar metabolism in the body. And diabetes 2 is at late age stages where body does produce insulin, but it is not metabolized properly, and it leads to sugar imbalance in the body. In Ayurveda, we call diabetes as a madhume. तो आयुर्वेद में जो मधुमेह बोला गया है उसको simply there is no distinction between type 1 or type 2. It just meant that you have increased sugar in your system, increased sugar in your bloodstream, and also you are urinating much more sugar out than what your body is able to handle because we are lacking either insulin or the metabolism of sugar is not happening because insulin is not able to work on it for the all the other reasons which we can discuss as we go along.
So can type 1 diabetes be reversed?
Panditji, the type 1 diabetes, the reversal is very not possible. It's very rare because what happened in type 1 is that you have a organ called pancreas or agnace, we can say in Pakwashe area, I mean, in the digestive tract, which is not able to produce enough insulin. And what happened in that is that's the reason is the mechanism of producing insulin from the pancreas is shut down for whatever reason. Sometimes it's just there is no insulin production. So that is not possible. But yes, you can rejuvenate the pancreas, the gland, and there is a possibility of producing certain insulin, and you may not need as much amount of insulin in your body unless in other case where you may have to take high doses of insulin. So type 1 is not reversible, but type 2 is reversible, and that is the very much difference. People have to understand how we can manage that part.
So, so I want to ask you one question because I saw my friend, like, some people, whenever they have a tea or coffee, they put a lot of sugar pouches inside. One of them was taking 5, 6 pouches. I told them, stop sugar, otherwise you will have a diabetes.
Right.
So he told me, sugar does not cause diabetes, but if you have a diabetes, sugar makes it worse. Is that right?
That's very true. When you have a diabetes and if you're adding sugar, that will make your sugar levels spike high. But saying taking extra sugar will eventually, if somebody keep on adding lots of sugar, then they are going to develop type 2 diabetes in later stages if their sugar intake is very high.
So, my
So, yeah.
friend, who you are, I'm not going to say your name. You know who you are, taking lot of sugar. So please control your sugar. And there are 2, 3 guys. So please control your sugar and listen to the doctor.
And, Panditji, now if we look at the statistics, since the invention of sugar and adding lots of sugar in our conventional foods, in our sweets, and, you talk about in anything, in US population, more than 12% of population is type 2 diabetic or the diabetic people. And also more than 2 million people don't even know that they have diabetes in US, whereas in India, it is a pandemic. It's really worse. The 77% of the population in India is close to developing type 2 diabetes, and they don't even realize that they are developing it because of the way we have changed our diet. तो आपका जो प्रश्न है कि शुगर ज्यादा खाने से शुगर डायबिटीज नहीं होती, not immediately but later on, yes.
So if somebody is eating sugar, I have read somewhere, is jaggery better or
White sugar.
white
Yeah.
sugar or brown sugar?
Yeah, the jaggery is a basically raw sugar content. Uh, it is a little better than the white sugar, but it is not a whole lot better. So jaggery does have, people do say, and they come to me, oh, I'm eating good, or I'm taking jaggery, but I'm a diabetic, I can take it. Reality is, if your mechanism of sugar metabolism is compromised, jaggery has a sugar in it. Though it does have other minerals in it, which helps a little bit, but that doesn't mean you can eat lots of jaggery. So, that's where we need to be very careful, especially if you are diagnosed with diabetes, is a type 1 or type 2.
Okay.
And the
I'm
same
going to,
principle applies to the honey as well.
okay. So you answered my question. I was about to ask honey. I was about to ask coconut sugar. I was about to ask. Some people say misri is also good. So that is
Mishri is
not good.
simply a white sugar. It's just crystallized sugar,
Okay.
and it doesn't change anything. It's just how the crystal is made. It still has a sugar. It's the same amount of sugar in it, so it does not change the level of carbohydrates. Either you eat a mishri or the white sugar, powder sugar.
Or
Jaggery
coconut
may have a
sugar.
little bit less sugar content along with minerals, so that's why people can sometimes get away. But again, there is a sugar. Honey is a healthy sugar, but people who have diabetes, they will have a hard time digesting that part, and their sugar will spike. So that's good. The coconut sugar will spike little less sugar level in the blood, but it will spike it up as well, if depending on how much sugar you're adding. The only thing we are finding, there are other sugar alternatives. That's your question coming. I don't know if you are going to ask.
Yes, that was my next question.
So
Like fructose, like there are two kind of sugar, fructose and glucose. So glucose is bad. How about fructose? Like people eating banana.
eating banana is Panditji is okay because the fruit has all the fruits carries the sugar. They are usually termed under the fructose. Basically, uh, but it will spike up. Like if you eat dates, khajur, it has a lot of fructose, but it will also spike up your fasting blood sugar level. And if you, on the other hand, uh, eating a papaya, if glycemic index is lower, it will spike your blood sugar a little less. So eating any fruit which has a sweetness to it will spike up the blood sugar level, no matter how good we consider. But the benefit of eating fruit is that it comes with lots of other antioxidants, so you do not have lots of side effects of sugar eating as a pure sugar compared to fruit which you eat, which also gives you fiber. So this sugar does not bring the spike up very quickly. It brings the spike slowly, slowly.
Wow, this is really, really, really good. And some people, who do not want to eat fruits, but they like to eat fruit juice, which they will just fiber is out. So that will spike it very.
Exactly. So that's what happened with the sugar, all the juices where the fibers are taken out, and they're only drinking the very spiked juices, which will increase your blood sugar because it is more richer in the sugar. So when you have a fiber, Pandaji, in the juices or smoothies, right? That's a better option because you're eating the whole fruit in a smoothie liquefied form, and those fiber actually does not let sugar absorb that quickly, so your spikes are very less. It's much more gentle, whereas when you take a straight sugar or juices which are concentrated, their spike is like this. So it's a very different type of sugar increase.
So to control sugar, I know, like we talked once, and you said, eat healthy and exercise. But you also said that Ayurveda offers perspective beyond eat healthy and exercise. So how does Ayurveda's holistic approach differ from conventional approaches to blood sugar management?
The Ayurvedic concept is eat according to your constitution, also eat according to the Vikriti, which is a pathological imbalances. Once we understand, Panditji, that you have a Vikriti, which is imbalance in the body, then we need to modify our diet. So knowing that you have a kapha rog, madhumeh falls into the increased kapha in the body. So we want to avoid the foods which contributes to this. In this case, all the simple carbohydrates, the sugars, which will be considered as the kaphas, so that would be, need to be restricted. And we need to, in people sometimes ask me, well, ghee and oils are also kaphas, but the ghee, those are fall into the vasa, in the fat part. It increases different types of metabolism in the body. So it will not increase your sugar. In fact, it will slow down your sugar. So if you combine good fats along with complex carbohydrates, the sugar absorption is very less in the body.
So is it okay to eat desi shuddha ghee
Yeah.
with honey?
Okay. ये क्वेश्चन जो आपका बड़ा टेक्निकल है पंडित जी. So this question, the reason I say when you combine honey and ghee, in Ayurveda we call it becomes a poison.
Poison.
Yes. When we combine, say, 4 grams of ghee, 4 grams of honey in equal weight, it is a poison.
So one
So
should not mix.
if you increase 8 gram of ghee and 4 gram of honey, then it is not a poison.
Oh
So
wow.
so the ratios have to be different. So आयुर्वेद में इसको बड़ा महत्व very properly बोला हुआ चरक संहिता में कि do not eat honey and ghee together in equal amounts because it increases too much of kapha's rog in the body, and it is very on the continuous usage is going to create lots of tumors in the body and cardiac diseases, hriday rog.
So some people who are like, like to drink milk in the morning, can they mix honey with the milk?
Yes, milk and honey is acceptable because it's a totally different types of fats in it, and milk also comes with amount of proteins in it, and milk has its own sugar, which we call lactose. And yes, it can be combined and it can be taken. But since we are discussing diabetes, Panditji, the new research have shown the people who have diabetes, those who have a madhumeh, should not be drinking cow milk.
Cow milk or buffalo milk, which is like a bhais, right?
Yeah,
Any milk is not good.
the basic studies came from the cow milk. You may be able to drink buffalo milk, goat milk, or sheep milk. But goat milk and sheep milk is more preferred in these individuals rather than because buffalo and cow milk में थोड़ा सा ही अंतर है. There is not whole lot a difference in between those two milks, other than the fat contents in the buffalo milk.
You already answered my next question, but that was how Ayurveda emphasizes individual constitution like doshas, vata, pitta, kapha, right? And how does those different constitutions influence how blood sugar imbalances manifest and how they should be addressed?
Yeah.
You,
So
yeah.
Pandit, if somebody is a vata dominant, let's give one say. These are the individual who are skinny, don't gain too weight, either they're too tall or too short in the height, and suppose they developed kapha rog. So the vata constitution means that their genetic coding is vata domination, so that will never change in the life. So like in your case, you're a pitta kapha domination, I'm a pitta kapha domination. हमारी कॉन्स्टिट्यूशन चेंज होने वाली नहीं है, पर जो पैथोलॉजिक कॉन्स्टिट्यूशन है, जो वात पित्त कफ है, वो किस तरह बैठते हैं हमारे शरीर में, वो चेंज होते रहते हैं थ्रू आउट द लाइफ. सो इन वाता डोमिनेंट, if the person is developing a kapha's rog, say they developed diabetes, so they have to now start watching how they consume the carbohydrates, amount of carbohydrate. They will probably respond better than an individual who is a kapha dominant and have a kapha rog, say a kapha dominant person developed diabetes. And in those individuals, we have to be even more aggressive in our approach because they already have kapha constitution. On top of they have kapha's disease. Whereas the vata domination person, constitution is vata, but he has a kapha's disease. So they will respond very differently Ayurvedically. So when we treating, when we making their daily routines, the dietary routines will be based on their constitution as well as on the based on their pathological imbalances, which will be vikriti.
Wow, Ayurveda, like we have a lot of stuff. So let's talk about some botanicals. Okay. You have highlighted several botanicals in the presentation I saw, like when we talk about it, and we are going to bring that presentation up in a minute. So let's start with Gymnema sylvestre. How exactly does it help to block sugar receptors, and what are the practical implications for someone with the blood sugar concern?
Panditji, Gymnema sylvestre is our very old herb and very respected herbs in Ayurveda. Its common name is called, Gurmar, which means the killing of the sugar. So in this herb, the Gymnema sylvestre is a is a Latin name for the good mark, and it has shown that it actually works on the pancreatic beta cells. Pancreas has beta cells, and there are islet cells in it. So the beta cells are responsible for producing insulin in the body. So the studies were indicated, which were in the lab, supporting that it regenerates the beta cells, which is a very unique. There is nothing in the modern medicine which can claim that it can regenerate the beta cells in the body. So beta cell का produce करने का मतलब है कि we are rejuvenating the pancreas. In this
But
case,
the evidence is primarily in vitro, right?
so which means in the lab testing, it showed that it was able to reproduce the beta cells.
Okay.
So, and it, which is good, which also indicates when we will take a Gymnema sylvestre internally, then it will reproduce the beta cells in the body. And beta cells are throughout the body, not only in the pancreas. We have beta cells in the fat cells. We have beta cells in the cardiac muscles, which are the heart muscles. Beta cells are throughout the body. So it supports that. And what it does, it improves the body's way of how sugars get metabolized. So that's basically what we see with the Gymnema sylvestre. It's a very important herb, and it is one of the things which will lower the fasting blood sugar in the individuals when they take it before every meal. So if you take Gymnema sylvestre before your meal, so any sugar in your meal or the carbohydrates, simple carbohydrates, they will not get absorbed in the system because it blocks the sugar absorption at the gut level and also supports your pancreas to produce that insulin through the beta cells. And that's how it supports the whole metabolism. So Gymnema sylvestre is one of the key herbs which have been studied very extensively and shown to be very effective. The other thing, if you any of your listener and viewers of this, if you want to try Gymnema sylvestre, take a little bit of herb or the extract of the Gymnema, put in your mouth for a minute or so, and then eat a sugar. You will not even taste the sugar because it blocks all the receptor sites of the sugar absorption, and that's why it helps to reduce the blood sugar in the body. So this is important. And also individuals who are type 2 diabetic and also have weight issues, or those are who are gaining weight, this herb can be very beneficial to those individuals. Similar to with the new generation GLP medicines, which are very becoming popular on online internet and also in the media, which helps to show that taking GLP medications, I will not talk about their trade names, but they also, reduce the weight, also improve the sugar metabolism. Gymnema sylvestre similarly works in that manner.
So, I came a while back and I to your clinic and I got one book. It was on curing cancer naturally, and it was talking about pancreatic cancer. I read one paragraph. I just remember that. Okay. So
Ji,
sorry to put you on the spotlight. So
no
there
worries.
was one doctor in Canada. He cured the pancreatic cancer with the help of camphor. Is it possible?
Pancreatic cancers are very aggressive. There are
Or
certain,
the pancreas can be cured with the help of cancer to regenerate whatever the is for the diabetes. That was
right,
my
right.
question.
So, Panditji, that's what I was addressing. There are different types of cancer which you can have in the pancreas, islet cell cancers and beta cell cancers, and all those can have, depending. Usually, once you have a pancreatic cancer, the prognosis of the cancer is not very good. The statistics are very against. Uh, Curing pancreatic cancers very rarely happens. Yes, you can make individual live little longer than average. Once you have a pancreatic cancer and it is metastasized or all that, the person individual's life is less than a 5 year considered in that manner because it spreads very quickly. But the treating with camphor, I'm not aware of. Camphor is a volatile oils, and it may have some value because those essential oils which are present in the camphoric oils, they may have some beneficial effect. But I'm not aware of where it can do all pancreatic cancer healing. So that may be one in a case where the individual lived, and there may be other factors to look into. Not only plain camphor probably will do the job in that individual. But to answer your making pancreas healthy, yes, Gymnema sylvestre, the one I talked about earlier, is very beneficial herb which can be taken to improve pancreatic health.
So there is another medicine you have, which is just this. So it is Indian Kino Tree. Is discussed with its ability to improve insulin sensitivity and reduce glycation. Can you give us some real world example of how this action translates to patient benefit? And
Yeah,
what is this Indian as in India or local Indian,
no.
American
Indian
Indian?
Kino is the name given to this Pterocarpus marsupium tree, and it is a it's also called Vijay in India, and that's the tree because and it has red tannins in the plant, which has all the active constituents like pterosilibines and marsupicin. These are known to increase insulin sensitivity in the body. What happens in type 2 diabetes is the people become insulin resistant. Their cells becomes insulin resistant. So Pterocarpus marsupium or Vijayasara or Indian Kino Tree, which whatever name you may know this plant, makes those cells very sensitive to insulin. So it starts working in a manner where it improves the metabolism of the sugar because the cells are more responding rather than being resistant to it. And it also has lots of antioxidant which actually helps in glycation process, which is a reaction between sugars and proteins that can damage the tissues particularly. So it prevents that. It prevents the damage to the tissues and also lowers the blood sugar. You can drink the water in the Indian Kino glasses, Indian Kino cups. You can put the water in it, and it leaches out all the actives. And you can drink this red water in the morning, and that actually improves. Another way is if you don't have access to that, you can use extract of this plant in the powder form or in combination with Gymnema. It improves that your sugar metabolism.
Oh, I have seen those cups. That looks like a wood. Is the same cup you're talking about?
Exactly. Those are the cups. Those are the cups which are very popular, and you can use it. The other thing about the Pterocarpus marsupium is that it has anti-inflammatory properties, and it can reduce the inflammation, which can also improve the insulin resistance in the type 2 diabetic people, and it actually helps to maintain the healthy blood sugar level. So, that it also there are some indication that improves overall liver health, gallbladder health as well. But when we talk about the trees and the plants and all that, they don't have one specific action, they have multi action. That means they improve overall functionality of the body.
So I have another questions
G.
on bitter melon. Like bitter melon has a long history of use. Is this Karela? I think so. What
It
are
is
the
a
key
Karela,
compounds? Yes. So
and
what are so in I'm from Gujarat. So in rainy season, mom always made the Karela ka sabji, because it's so bitter. We kids never used to eat it, but then we were forced to eat. So it has a long history of use. What are
yeah,
the key compounds in it that contribute to blood sugar lowering effects? And are there any precautions people should be aware about? Some
Karela
I
is
went
Karela
the
or the
yeah.
bitter melon, also Latin name of Mardica charentin, is actually beautiful vegetable. It should be consumed by all age groups who especially adults who are known to be pre-diabetic, the whose fasting blood sugar are just inching up high. it actually has a bitter compounds. That's why it's called bitter melon, uh, that known as cherentins, and they actually have insulin-like activities. And because of this alkaloid, it really helps the glucose metabolism in the body and help in lowering the sugar. So if you can drink bitter melon juice, uh, or you can eat as a sabji, as a vegetable, uh, without without getting too much salt to take the bitterness away. That's better. More the bitter it is, better it is. And maybe the people who never eaten bitter melon, they can start with by putting a little bit salt to decrease the bitterness in the Karela. But it's better to eat whole Karela as it is with all the spices, the special our Indian cooking. It will help to lower the blood sugar as well.
You answer my second question. My second question was, you know, in certain places like in Gujarat for sure, because we Gujarati eat a lot of sweets, right?
Ji.
So, and so even in Rajasthan, I've seen one of the Rajasthani cook when I went to India, he made a karela ka sabji and like I ate it multiple times. And then because it wasn't bitter, so I asked him, how did you do it? He said, we use salt to remove the bitterness. So you answered that question. So what happens if you use salt to remove bitterness? What properties of this? What are the compounds that will go away?
Yeah. So the main bitter compound will be removed out of the bitter melon because salt has that extraction property. It reduces the cherentin compounds and momardicin compounds, which are bitter compounds. So that means the very bitter compound, which is supposed to work like insulin in your body, you have reduced it. So that sabji actually has a not much value, very little value left. So the herb or the Karela, which was going to work like 100%, you reduce its efficiency by 50% by reducing the bitterness.
So fenugreek, the methi is also good for that.
Fenugreek is very good, Pandaji. It's a fenugreek actually known to reduce blood sugar as well. So the way you can eat fenugreek is soaking a tablespoon of fenugreek seeds overnight or soak it for 24 hours, and very early in the morning on empty stomach, take that fenugreek seed, chew it well. It will have a little bit bitter compounds in it, and it also has lots of good fiber. It does help in managing the blood sugar.
So do you have to soak it or you can just take it like that?
You can take it as it is if you want to do it. But I find soaking fenugreek overnight uh, actually activates the compound within the fenugreek seeds, and it's like how that start the process of like seed is going to grow. So that water actually activates the growing effect of the seed, which is very beneficial along with the fibers in it.
And what should you do with the water?
You
That
can
water.
drink the water or you can throw away the water. The seed has more value. The seed water will not have much of dissolved active compound because fenugreek doesn't easily dissolve its active compounds in the water unless you boil it. If you boil it, then you got to drink that water as a tea because it will have the bitter compound in it. If you soak the seed in the cold water, leave it overnight, then that water will not have any much compound in it.
So always use cold water. Is that what
Uh,
it is?
yeah, I would recommend soaking the water in the the fenugreek seed in the cold water overnight. Let it swell up by the morning, and usually you're gonna see the fenugreek seeds are a little bit more thicker in 24 hours. And if they start sprouting, that's even better. So those have very good value for the body as well.
And it becomes soft also, right? Easy to
It
chew.
becomes very soft and easy to chew on it. I like people chewing the fenugreek seed in the mouth. So even though it will have a little bit of kasalap and the bitterness, but that's medicinal.
So there is another thing, neem. So it is, we use neem for a lot of various purpose. So how does it help with the blood sugar and pancreas protective function or its effect? So how does it help? Neem.
Neem, Pandaji, you know we always talk about neem as the one of the very bitter herb, right? I'm sure you have either brush your teeth with the neem stick, or your mom may had used
We
the
did in the gaon
yeah.
mein.
Yeah. So, or you might have eaten the leaves, or your mom made some
Curry.
curries with the neem leaves, which the kids will run away as soon they will find out the neem leaves are used. But neem actually is very much medicinal herb. Everything what comes out of neem tree is usable as a medicine. Either you talk about neem seed, you talk about neem bark, neem leaves. So it is every part of the neem tree is a medicine. So in this case, we always recommend when we're talking about the hypoglycemic effect, that means the things which lower the blood sugar, using the neem leaves, and you can make it as a powder, or you can make it as a paste and eat as it is. And neem leaves has active compounds called azadirachtin, which actually behaves has insulin like activity as well. It lowers your blood sugar, and it also helps to stimulate pancreas in the body, and it lowers the blood sugar when you eat some food which are sugar loaded or carbohydrate loaded. If you have eaten neem or taken a neem juice before, uh, it will not that hyperglycemia, that means increased sugar level in the body, will not happen in that individual. But that does not mean that you start eating a lot of sugar and drink neem juice to balance it out. The idea is to understand that it has that medicinal value. Once in a while, if you have eaten sweet, yes, you can do that. But as a medicine, if you're a type 2 diabetic, the neem can be taken as internally to improve your type 2 diabetes, and also improve your health of the pancreas in the body.
I know one of my aunt who just passed away. She was diabetic, and she was she will say, I'll take the shot, but I need to eat sweet. So how do you help such people? How do you convince them? There is no way to convince them, right?
I mean, in people are people. At the end of the day, they have to take their own decision. What is more important for them? Having that 1 or 2 minutes of pleasure of having sugar. Sugar is very addictive, Panditji. We all love sugar, and that's why it is considered that it's very addictive. Uh, but once you know that you have madhumeh, that means you have too much sugar in the body. Somehow, body sends you that craving messages that you need to eat more sugar. And that's exactly what was happening with your aunt, that she was craving sugar, and the only thing she could do is to take sugar and balance it out with the neem to cut down the side effects of a little bit of sugar she was eating. But I'm sure she lived probably fairly long. But you know
Fairly long, 92 years.
yeah. So, yeah, she was managing her blood sugar imbalances with taking the bitters like neem and karela, which probably helped her.
I hope so. So, guys, if you have any questions, please comment. We are live. You can put your comments and we will definitely answer. Please like, share, comment, and subscribe. Now, one thing I have want to add to here is now, we all know Tulsi, right?
Tulsi is the Pandaji is it's amazing herb. Not only we worship it, right? I mean, you can probably talk about Tulsi all day and still not be done with the Tulsi. Same here. So I look at Tulsi as it's a we call it holy basil for the reason because we worship it. It's ossimum sanctum. The sanctum part goes for the holiness of this plant. Not only we worship every day, but this plant is a immunomodulator. That means it supports your immune system, has a which improves the body's fighting capacity to bugs with the viruses and bacteria. It also, on the side note, it improves body's overall functionality of improving the blood sugar metabolism. So what nice thing you can have is every day having tulsi tea, tulsi leaf tea, or tulsi seed tea. And not only you will improve your immune system, but it will also help the blood sugar level.
So Tulsi is like basil is the family, right, of the plants.
Yeah,
So
holy the
any
basil,
basil
the
is good,
Krishna tulsi.
or you need holy basil only.
Holy basil is what have been studied, not the sweet basil. Sweet basil has some effect, but they always talk about oxalic acids, which are present in the sweet basil a little bit more. But the tulsi has its own compound, the Krishna tulsi or the Ossimum sanctum. That's why I use the name, Latin name, to justify what plant has much more medicinal value. The plant which we worship in India's every house outside, that is the plant which has a lot more medicinal value.
So
And it
that's
also
right.
has anti-cancer value, Panditji, by the way,
And
on the side.
anti-cancer value. Wow.
And it also balances out the anxiety. It balances out the adrenal glands. It also makes our brain a little bit more smarter. So wearing the tulsi mala, the aroma which the essential oils goes, constantly balancing out that part. That's not part of today's lecture, but I thought I put in a couple words about it.
So one of my friends said, there is one vegan restaurant here in Seattle area. So they make a tulsi curry made out of tulsi, but I don't think it's a holy basil. So that was I asked you the question. So does it have to be holy basil or any other basil is fine?
All basils will have some effect. They are good. Mostly the curries are made that's from the sweet basil, which is like in Thai curries are available. Thai food contains that lot more. Indian cooking only uses holy basil up to certain spices or as a tea. So that's basically it's different. But yeah, the basil family in general will have some medicinal value, Panditji. But the holy basil, the Ossimum sanctum, is actually the best.
So there is another like ये तो jambu है ना, jambolan.
And you jumbo.
So how does it help in controlling sugar, with the especially fasting blood sugar? We talk about fasting blood sugar. So what's the ideal sugar level?
Let me talk. You have asked me two questions in this very particular question. The jambul actually, what is it? It's a jamun which comes in the July season and in the summertime, and it has the active compounds like we call it ellagic acid and jamboline, which are present in the plant. It helps to absorb, to stop the absorption or the conversion of starches to the sugar. So the starches do not convert into the sugar in the body. So that's how it stops the spike of the sugar. So that's one thing how it supports your blood sugar level. And the other question you had was on the which was uh, you know
Blood
that
sugar level. What's the
yeah
ideal fasting blood sugar level?
yeah, the fasting sugar levels are usually we measure from 70 to 110 nm, which is the fasting blood sugar. And postprandial, that means after eating the food, your sugar level should not go more than 130, 140 level, which should come down on it. So the younger population who are healthy individual, they do not see that spike, but the older population, they can see that postprandial sugar can go like 130, 140, but then it drops back into the 110 range, yeah, 70 to 100 range. Current guidelines have switched from 70, 110 to 70 to 99, and that's considered normal range. And our A1C, which is a glycosylated hemoglobin A1C, in this case, we are checking the sugar which is attached to the hemoglobin, which tells us the 3 month average should be less than 6.4, from 4.8 to 6.4. And that's more predictable value to see individual if they are maintaining low sugar diet or if they are eating high sugar diet, and also
So,
if they are pre-diabetic.
so guys, you need to have your groceries ready. First thing you need to have methi, then bitter melon fruit. Okay, then this you can buy, but then you need neem use in your, and then holy basil in your food, and always use jambu,
Yeah,
right?
when the season comes, I will say eat jamun as much possible. It has a great anthocyanidins, those blue pigmentation, which you chew on it. It's very healthy for the gut, and it also improves the gut flora with all the fiber which it has in it.
So is it a prebiotic or probiotic?
It is prebiotic.
Okay. So this is the barbarian. This is
Y-
the organic chemistry diagram. I do not understand this. So can you?
We will not go into organic chemistry, Pandit. It's just a structure of berberine, which you see how the
It's all
methyl group.
carbon, right? This is all because of the carbon-based compound. So
Yeah, the
that's why
methyl
it is.
group and attach of nitrogen and oxygen, how it matches, attaches to it. But the berberine compounds are very complex compounds, and we have plant called Berberis aristata, which that's the Latin name of the plant.
An Indian
And
name.
yeah, it is an Ayurvedic, and Hindi name or Sanskrit name is called Daru Haridra. It is very much available. It has a yellow pigmentation, which is called berberine, and it is a very bitter compound. It's not the only plant which has a berberine. There's a golden seal in West in America, which has a berberine compound, and then there is called Oregon Grape Valley, which also has a berberine compound. And our Indian barberry, which I talked about, Daru Haridra, contains that.
He also wants to be on the stream. Say hi to him.
He's my Kona lapdog, which loves to talk of him as well.
You can take
So
him in your lab, doctor. You can take him in your lab. He really wants to be in your lab. Hi, Kona.
this is our Kona right there. He's listening, Panditji, to you. So the berberine, like I mentioned, has because of its bitter component, it is a very antimicrobial, and it is good for lots of bacterial infestation and infections which happens in the body given, and it also has immunomodulating effect. But what we are finding, the berberine actually has very similar effect like GLP-1, which I talked earlier when we were talking about Gymnema sylvestre. Similarly, berberine has a very same effect. It helps to lower the blood sugars, and also help with the weight management in the individual because of the bitter component. So it improves the overall metabolism. So it's a good herb to take, Panditji. It's bitter, but yeah, I think people have to get used to taking it. But or you can take a capsule of this. That is very beneficial.
So this is betaine HCI.
As betaine hydrochloride, it's
Uh,
HCl, and
HCl, sorry.
it is an enzyme, Panditji, which is actually helps to support the absorption of blood sugar in the body, and it creates a balance. That betaine actually helps with the methylation process, which is another way of saying that it improves the liver function and also improves the detoxification in the body, and it does reduce the increased sugar level from the liver, and it actually improves the glucose metabolism from the liver. So it's a betaine hydrochloride, and it's a like an acidic compound. It's an enzyme which really are very helpful.
So how do we one take this? Is there any
It's a
medicine?
part of the formulation. The majority time, and I think you will see the last slide, which has a product name called Gymnema. It has in it. And then you talk about biotin. Biotin is also very. It's like a vitamin, and it
Hair
improves the
growth, hair growth, right? Does
hair,
it
skin,
support the
nails,
hair
and
growth?
in the women, it's very beneficial in that matter. The nail growth the women always talk about, and the hair growth in the women talk about. It is very beneficial, and it works as a coenzyme, and it also helps to break down the carbohydrates and also converting glucose into energy cells and maintaining the cellular structure. It's very important biotin, and you don't need a whole lot to take. The small quantities of biotin is very good enough to take to see the improvement, and it supports the insulin function in the body, improving body's ability to use glucose. When you take biotin, improves very effectively, very efficiently.
So I have one more question, but I will go to the next after the next slide. So this is
Chromium.
chromium.
Chromium actually been studied a lot, Panditji, on its effects on the pancreas and beta cells and sugar metabolism. So we find that it really helps when you take in the micro dosages. It improves in all those matters. It helps with the fats cells too, but it also improves the glucose metabolism.
And Karela has it, right? Karela has
Karela is
it.
different. No, Karela does not have chromium, but Karela has a bitter melon, charantins, we call that.
Yes, yes. Okay. So this is good. So chromium. Okay. So and there should be some medicines available, if not.
It is available and it's part of the biogymnema.
So this is the medicine,
This is the
biogymnema.
medicine biogymnema, which contains all these ingredients and very helpful in maintaining healthy balances of the blood sugar and metabolism. And, like I said, basically people who have diabetes, either type 1 or type 2, or caused by the medication and all that, you need to understand that you have a sugar metabolism issue and you need to cut down the sugar in any form and reduce. Even if you reduce your sugar intake by 50%, you will see a whole lot improvement. And there are sugar alternatives available these days, like stevia, monk fruit, and allulose. Those are the sugar alternatives available, and these are the healthy alternatives compared to the aspartames, which are were previously given and known to be cancer causing. So if you have a sweet tooth and you think you need sugar, then consider either stevia, monk fruit juice, or monk fruit sugar, or allulose. Those are the things which you can consider.
Not even the coconut sugar, right?
Coconut sugar will still have a little bit sugar spikes. You can take that little bit, but it will bring the spikes. The
So
stevia,
stevia is
allulose,
better.
hanji, stevia,
Stevia.
allulose, and all those things will not increase your sugar spikes.
Good. So this all boils down to is lifestyle intervention, like, so can you suggest what are the key dietary and lifestyle recommendation you would like to give to your patients or our viewers to manage their blood sugar?
The best thing for the diabetic people is in Sanskrit, in Ayurveda, it says for people who have madhumeh, if they walk 6 ko, that means walk every day, for 6 miles minimum, your blood sugar will naturally go down because you will burn the sugar. Your cell will be able to utilize that sugar, excessive sugar. So walking is important. Make that as a habit of your daily routine. Cut down the sugars in the diet. Consider complex carbohydrates. Consider more leafy green vegetables. Proteins you can take either vegetarian labels proteins, or if you're a non-veg person, then you can consume that. I don't push too much non-veg, but yes, individual who can eat it, that's fine. So there are lots of protein substitutes are available which can be taken. That all helps to lower your blood sugar.
So you said about 6 mile walking or 6 kilometer walking.
Well, Panditji, start walk. You know, not everybody can walk 6 miles, but I will say start somewhere. Even start with a 1 mile walk every day, which is equal to close to 10,000 steps. So, if you can do that, that still will lower your blood sugar. They say in Ayurveda book, it says people who walk 6 ko, they become diabetic free. That means their diabetes runs away. So they
Course,
can
right?
reverse that.
Course to
Yeah,
mile.
6 course. Yeah, 6 miles. 1 ko is actually more than a mile, but yeah, I'll just bring that close to, you know.
1.99 miles. 1.9 miles.
Yes, so that's
One
close
course.
to 12
Imperial
miles.
US unit.
Yeah, that's about 12
So
miles.
multiply almost 2 miles.
Yeah, in
So
old
for
times, the Panditji people used to work in the field. They will walk. They did not have
12
motorcycles. They did
miles
not
a
have
day.
cars. Yeah, or or you can even do the bicycles. Yeah, some sort of
Oh,
exercise will be helpful.
how about weightlifting? Does it help?
Weightlifting will be help, but gentle weight. Don't start with very heavy weight. Start with any amount of weight and progress slowly. Yoga helps, breathing helps. Having good sleep will improve your blood sugar. People who don't sleep well, their blood sugar spikes will be very high in the morning because the cortisol levels go up, the stress factors goes up. Stressful job people who do, their blood sugars will always go high because of the adrenal glands. So that's where the holy basil comes very much convenient for these individuals. So sleep, do exercise, do yoga, do pranayam, do meditation, and eat a lot more green leafy vegetables. Eat karela every day if possible, and add tulsi in your diet. These are the things which definitely can help you to lower your blood sugar.
And in the most people, like in the United States and the Western coast, are into IT, so stress level jobs. So people, guys, eat healthy. Point number one, do workout. Sitting on chair for a long time does not help you much. Go and do some exercise, some walking. That applies to me also.
Exactly.
So,
We all are part of that, Panditji. So we need to get more mobile.
and by the way, this medicine, if you want to buy, they are available in Amazon and also on Dr. Sodhi's website, Dr. Ayush herbs. You can just Google it and you will find Ayush herbs. So please do take a look at it. And by the way, this is not sponsored in any terms by Ayush Herb, this program or show. We just want to give some kind of formulation which is trusted and available. So we are just giving you it here, and you can buy it from Amazon and from his website, Ayush Herbs. And Ayurveda also. R is then the letter, and U is also letter, and Veda, Ayurveda,
Yeah.
right?
Ayurved.com, Panditji. Ayurved, RUVED.com,
Okay.
Ayush.com, AYUSH.com. And this supplement, Gymnema, is available. It's very beneficial to managing healthy blood sugars. So, for all your viewers who are struggling with the sugar metabolism, this supplement can be life changing for them.
So how many tablets a day? One in the
Usually,
morning.
one capsule we recommend to start with, but if you are known to have more eye, you may want to discuss with your naturopathic physician or Ayurvedic physician, and you can take one capsule before each meal.
And before each meal means how many minutes before?
Usually, even as long you take it before meal, you're fine. But the best thing is 10 to 15 minutes before meal.
Like drinking water, because you have to drink. I mean, not really. If you have to drink water, drink 10, 15 minutes before or half an hour after, likewise, right?
Yeah, the water drinking is one thing I tell people not to push too much at the time of meals, but just take a little bit sips to swallow your food. But yeah, you should be drinking water in overall a day, half of your body weight in ounces. That's what you should be drinking. I usually tell 6 to 8 cups per day is minimum required for hydration.
So, with this, I would like to thank you, doctor. Thanks for coming. Thanks for joining the stream. And so, what's your next plan? When do you? So, what do you want to present it next time?
I think let's Panditji, we have discussed a very important condition so far. So next condition can be hypertension, high blood pressure, uch rakhtachap, which is also very much I see a lot of population is suffering with it, and it's also contributing factor for heart diseases. So let's talk about the hypertension, uch rakhtachap, and that can be our June month's topic.
Sure. And please, guys, stay tuned. But let me ask you one thing before we part. is there any tablet, like instead of doing running or just people take it, gets equal amount of things? That was a joke, by the way. So there is no medicine. One has to work out. So there is no medicine that gives you equal amount of like running and all. So I would like to thank Dr. Sodhi. Thanks for joining. And please, I would like to thank you more for giving our viewers the valuable advice. And thank you.
Thank you, Panditji.
Pranam.
Pranam.
Please like, comment, share, and subscribe.